You know, tendon injuries can be painful, obstruct your way of life, and last for a while, but they can also be healed and fully regenerated with cellular therapy. Here with more on what exactly that is Dr. Daria Mazzubi of Maj Medical Clinic in Visalia and his patient, Elizabeth Valdivia. I know you have a great story to tell, Elizabeth, but I'm going to start with Dr. Maj. How does stem cell therapy help tendon injuries, doctor? So
stem cell treatment includes platelets and stem cells. The platelets provide the growth factors, and the stem cells, it stimulates the stem cells to produce and regenerate the tissue, the injured tissue that's around it. So when we inject the stem cells with the platelets, with the fat cells, which provide the scaffold for the stem cells to work on, it begins to regenerate the tissue.
And that's coming from your own body.
Correct.
Right. Wow. So it's the body healing itself, basically.
Right.
Tell me your story, Elizabeth. What was your pain like, and what had happened?
I was in a car accident in 2014, and I had this real sharp pain, like a piercing pain, for about 6 months. And I said, oh, I got to go see the doctor. So I went to see Dr. Mazzubi, and he had me take an MRI. And then after that, the MRI came back that I had a tear, and he recommended the stem cell. I was a little nervous, but I'm so happy I went through it. I didn't have any pain medication during the surgery, and it was a little sore after like 2 or 3 weeks, but after that, it was so, I mean, I don't have any problems. I'm so happy about that I went through with it.
That's amazing, because, you know, a lot of people get into some sort of accident, car related or whatnot, and their neck and then they go directly to doctors that can give them medication. Talk to us about, because we have pictures also of how the tendon looks before and then after.
Sure. Just on her case, she did take medications, and she actually got a cortisone injection that didn't really work. And then after that is when we decided that this should be the thing that we should do, and it really helped her. So here's a picture of a tendon just like hers. And you see a hole in the middle, that's the partial tear. And in the next picture, this is 2 months after the treatment. As you can see, that hole is being filled, and the tendon is being regenerated with new stem cells and cartilage cells. And then this was a basketball player that actually started playing basketball 6 months after the treatment. And here's a picture 1 year later, and you see that the tendon is completely healed.
But so how long does it take for them to feel better, for a patient to not feel the pain? I mean, it seems amazing that from one day to the next.
No,
is that what happened?
About 2 or 3 weeks, I had no pain. I was like, oh, I had even forgot. I was like, oh my God, I don't have that piercing pain anymore.
Wow. Is that common for a lot of your patients?
Yeah, so initially when we do it, because of the fact that it causes some inflammation, they actually have a little more pain for the first couple of weeks. And then after that, probably by the 3rd week, they start to feel better. And they turn the corner. And usually anywhere from 3 weeks to 8 weeks after is when they really start to feel that there's having less and less pain.
I'm happy.
What do you say, Elizabeth, to people that think that this can't, I mean, how can this possibly
Well, I
work?
kind of thought that. I was like scared, like I never heard of that. I'm like, oh, I don't know. I'm so happy I went through it. I trusted him. I felt comfortable with him. I didn't even have pain medication during the surgery. It was great.
Wow.
Afterwards, I'm so happy. Like, I can do anything with my shoulder.
You're kidding. And so this is her sholdder, but do you also do other tears, like on knees, and I mean...
Sure. So we do patients that have ligamental tears, as long as they're not full tears, they're partial tears, because the tear has to be close together in order for the regeneration to occur. We do, you know, tears in the, I have patients that have had Achilles tendon tears that we've injected, just like the picture that we saw.
Yeah. And how do you get the stem cells?
The stem cells are harvested from the fat around the belly here. And it's they're around the blood vessels around the fat cells, and they're called the stromal vascular cells. And there's a group of stem cells that are there. They're precursor stem cells, and these stem cells turn into cartilage, bone, muscle, tendons. And so the platelets actually help them regenerate and stimulate the cells.
And doctor, for those people wondering how much this is going to cost, let's talk a little bit about that really quickly, because we only have about 30 seconds, but I know that's on everybody's minds, right?
Sure. So I can tell you in Los Angeles, they charge anywhere from $9,000 to $12,000 for the treatment. For us, we charge anywhere, depending on what the injury is, anywhere from $5,500 to $6,500 for the injection.
Wow. Yeah.
Normally, it's around $6,500, which is a lot cheaper than what they can get in.
Yeah, almost 40 to 50%. Wow, this is really eye-opening. So I thank you both so very much for being here. I'm so glad you feel better, Elizabeth. Really, it's amazing what you're doing, doctor. So anyway, give him a call. 740-7989 is his number. You can also visit him online at medicalclinicvisalia.com. That's the website, and he is located in Visalia, right off of Goshen Avenue. Thank you so very much. It's great talking to you, as always. Thank you. All right, stay with us, everybody. More Central Valley Today when we come back.